All right, let's dive right in. We're going to cut through all the noise and confusion around health insurance. Forget the complicated jargon, forget the tiny fine print. Today, we're going to figure out how to find a plan that's not just affordable on paper, but actually affordable when you really, truly need it.
And wow, doesn't this just hit the nail on the head? We've all had that feeling, right? You're at the pharmacy or you get a bill from a doctor's visit, and the price is just way higher than you thought. That's usually the moment that kicks off a frantic search for a better plan. Well, this explainer is all about turning that panic into a focused, confident choice.
So, that brings us to the big question. When you see a plan advertised as affordable, what does that word really mean? Is it just about what you pay every month? Well, as you're about to see, the real story is a little more complicated than that.
And this, right here, this slide shows the biggest trap in the whole game. It's so easy to get drawn in by that low monthly payment, but that's only one piece of the puzzle. Real affordability also includes what's called cost sharing. That's the money you pay out of your own pocket when you actually go see a doctor.
Now, to figure out that total cost, you don't need to be an insurance expert, I promise. You just need a simple toolkit. So let's get you set up with the 4 key numbers you absolutely have to know to make sense of any health insurance plan out there.
Okay, first up, the premium. This is the one we all know, and I love this analogy on the slide. Think of it as the cover charge. It's that fixed fee you pay every single month just to be a member, whether you use your insurance a ton or not at all. Next up is the deductible, and you really got to pay attention to this one. This is how much money you have to spend on your own healthcare before your insurance even starts to chip in. And here's the trade-off. A really low monthly premium often comes with a crazy high deductible, which can leave you on the hook for thousands of dollars.
Then you've got copays. Now, this is where things start to feel a little more normal. A copay is just a simple flat fee, like $25 for a doctor's visit. It makes budgeting for regular stuff way easier. But just be careful, sometimes these don't even start until after you've paid that whole deductible. And last, but definitely not least, the out-of-pocket maximum. You can think of this as your ultimate financial safety net. It is the absolute most you will ever have to pay for covered care in 1 year. Once you hit that number, the insurance company pays for everything, 100%. This number is what protects you from a medical bill totally wiping you out. Okay, so you've got those 4 numbers down. Now, before you commit to anything, there are 2 more checks you have to do. Think of it like a pilot's pre-flight checklist. Skipping this part can lead to some really nasty financial surprises down the road. Check number 1, the provider network. This is just the list of all the doctors and hospitals that have a special deal with your insurance company. Sticking with doctors in-network is absolutely key. Why? Because going out of network can mean your bills are way, way higher or sometimes not covered at all. And check number 2 is the formulary. It's just a fancy word for the plan's list of approved prescription drugs. And it's not just about whether your medicine is on the list. You also have to see what tier it's on. A drug in a lower tier is going to cost you a lot less than one in a high tier.
So this is it. This is your 5-minute reality check. Before you even think about signing up, take 5 minutes. Seriously, that's all. And answer these questions. It is such a small amount of time that can save you a whole year of headaches and surprise bills.
Okay, so now you're armed with all the right questions, but where do you actually go? Where do you find these plans? Well, let's look at the 3 main places you can shop for health insurance.
This chart breaks it down really nicely. First, you've got the official marketplace, like healthcare.gov. This is the only place you can get those income-based discounts, called subsidies. Second, you can go straight to an insurance company's website. That's great if you already know exactly which plan you want. And third, you can work with a licensed broker. They can give you expert help, but just make sure they work with a bunch of different companies, not just one.
So you found a few plans you kind of like. How in the world do you actually compare them without getting totally lost in spreadsheets and confusing fine print? Don't worry, there's a really simple method to find the best fit for you.
This 4-step process will give you so much clarity. First, don't try to compare 20 plans. Just pick your top 3. Then, for each one, map out what your costs would be in a totally normal, healthy year. And then, and this is the most important part, figure out your costs for a worst-case year, a year where you actually need your insurance. Then you do those final network and drug checks we just talked about. And here's where it all clicks. Look at Plan A. The premium is super low, but if you have a bad year, you could be out $8,500. Now look at Plan B. Yeah, the premium is higher each month, but your total cost in that same bad year is capped at $6,000. This is a perfect example of how a cheaper plan can end up costing you thousands more.
And that brings us to our final and really critical section, how to avoid the traps. Because some plans are designed to look like a bargain, but they can end up being incredibly expensive if you ever have to use them.
One of the biggest red flags to watch for is a short-term plan. The price looks amazing, but they are often full of holes. They might refuse to cover any health issues you already have, or they might put a low cap on how much they'll pay out if you get really sick. It's kind of like buying a car without looking under the hood. You've got to be really careful.
And you got to keep an eye out for other hidden costs. You can get a surprise bill if your in-network doctor sends your blood work to an out-of-network lab. And some plans have these prior authorization rules that can delay your care for weeks. This is why checking that network and reading the details is just so important.
You know, this quote really gets to the very heart of it, doesn't it? You're not paying that premium every month for when you're feeling great. You're paying for peace of mind. You're paying for protection for that one awful month when things go sideways. That's the whole point.
So let's pull all of this together. After going through all of this, how should you personally define what's affordable? It really just comes down to a few key ideas.
Here it is, your final cheat sheet. Real affordability means you look past that shiny low premium and you look at all four numbers: the premium, the deductible, the copay, and that all-important out-of-pocket max. It means you do your homework on doctors and drugs. And most importantly, it means you pick the plan that you could actually afford to use in a worst-case year.
And that's really the question I want to leave you with. As you're looking at your options, just ask yourself this: are you shopping for the good months, or are you preparing for the bad one? Your answer to that question is what's going to lead you to the plan that's truly the right and the most affordable choice for you.